Thank you for joining and doing this today. You've already done a bunch of the L&L updates through the TOA and that kind of thing, but just wanted to hear like what you guys been up to and what you've been working on and what you go down to Austin for all the time.
Yeah.
Why don't we start with the scope bill that passed? That's probably as good a place as any. I know a lot of information's been passed out already, but just why don't you summarize that? Where are we at on that, or what else is coming up?
Yeah, so we were fortunate to finally, after 22 years, get our scope of practice bill, or practice act, updated. It was not easy. I can kind of go into more detail about, how the sausage is made, so to speak, but from a big picture level, optometrists in Texas are finally going to be able to practice in a full medical scope of practice to treat all patients, short of surgical services. That's what we couldn't quite get across the finish line. But short of surgery services, the changes that are made in the bill that will go into effect September 1st, so we're just a couple days away, are just the full ability to prescribe any oral medication. So we won't have any artificial limits on how you can help a patient now using oral medication, which of course there's just tons of applications in that realm. And then the other big issue is we finally got rid of the old glaucoma law that forced optometrists to co-manage every single glaucoma patient when we diagnosed them and encountered those patients. So, if anything, just finally being able to practice independently in a full medical scope is what we just achieved as a profession in Texas. So, we're really proud of that. The TOA just worked super hard on this. It didn't happen overnight. We tried 2 years ago in the last session to pull this off, and we came up just a little bit short. So we reloaded for this session, and a few political windows of opportunity presented themselves. So of course, when you have hay, you make hay. So that's what we were doing down there, and it takes a lot of effort from our volunteers, our key contacts, which have relationships with all the legislators in Texas, our staff at the TOA, and our lobby team as well, who are professional lobbyists and live at the Capitol basically and are very influential. So it took a big team of people to get this accomplished, and even accomplishing it doesn't feel like it's real, because it's just that hard to get it done against organized opposition. So a few things fell into place, and we were able to get it done at the end of the day. But there's a lot of people to thank for this, because it truly is a big team effort. Like any of our practices, if you're a good sized practice, you've got 6, 8, 10, 15 staff people, and it takes every single one of those people to pull off a day in practice, right, to make your business run. Well, it's the same way for the legislative effort. It takes about 250 folks, to really pull this off, and I mean that, it really does. And we have 4,000 optometrists in Texas roughly, and so a few of those optometrists are hyper involved with politics and their local political districts. They're House members, they're senators. So that network is what we call the grassroots, and that grassroots is just very strong for optometry, and we were able to overcome intense opposition to getting this done. But that's how it happened. And over the course of the 5-month session, there's always highs and lows, and we were able to overcome those lows. There's a few moments that we thought the bill was dead, and we had some real hiccups there along the way. But
on the chance,
a few of our friends just at the end of the day stepped up and rescued the bill and got it done.
Yeah, and for anybody who's just dipped their toe in this world, I think one of the phrases that's commonly used is there's only one way to pass a bill and a million ways to kill a bill, and it really is a miracle that anything gets done on any any subject, it does take a lot of work and a lot of effort.
Yeah.
On the content of what just passed, if a doctor by chance is hearing about this for the first time and wants further information about the specifics of what is new and what's different, what's the best way to find that? Is that through the TOA? Is there a resource within the TOA that you can use?
We've put out several, things since the bill was signed into law. The governor signed the bill about 2 months ago, roughly, and the effective date of the bill is September 1st. So next week we'll all be celebrating that day. It'll be a big moment in Texas optometry history. The best place to go look at it is you can Google it, of course, but there's a website called Texas Legislature Online, and you just put into the search bar SB 993. That's the name of the bill, Senate Bill 993. So you can, Google it and find it that way, or just wait to see more TOA emails that come out. But if you're hearing about it for the first time, just Google SB 993 Texas optometry, and you'll be able to read the bill. But the synopsis is exactly as it described. It basically, every optometrist will be able to use any oral medication that's used to treat eye disease with no limitations. So no more length of prescription issues. Before, we had limits on antibiotics for 10 days and weren't able to do oral antivirals as a class of drug, which is super important to what we do. We couldn't use oral steroids, which is super important to what we do. So now there won't be any restrictions for class or time. So it's a really big open-ended oral medication law now. The only restriction on oral medications is for controlled substances. So we still won't have the ability to prescribe any Schedule 1 or Schedule 2 controlled substances. And, most of that is non-controversial. The only slightly controversial thing in Schedule 2 is hydrocodone. We previously were able to prescribe hydrocodone, but now because of the opioid epidemic, they've really tightened up on that. So we weren't able to put hydrocodone back into our formulary of things we can do, but that's okay. If you're prescribing hydrocodone, you might want to look at other ways to treat pain anyway, just because it's kind of pain to go through all the regulatory mechanisms now to even do it if you wanted to. And then the other main chunk of the bill, of course, is glaucoma. So as long as I've been in practice, we've had this arcane process of finding a glaucoma patient, knowing they have glaucoma, doing all the testing, and then having to refer that patient to an ophthalmologist or consult with an ophthalmologist. And, that took on a lot of different forms depending on where you live and if you had access to an ophthalmologist or not. So, of course, that law presented a real host of problems for the patient. Trying to comply with the law was next to impossible. And so that's why we wanted to change the law and update it. And now optometrists in Texas will just have the independent authority to treat glaucoma, and diagnose it, treat it, and manage it without having to do that consultation. There is a limitation on the glaucoma law as well. If you diagnose and find that the patient has severe glaucoma, and that has a very specific definition, and we actually use the Academy of Ophthalmology definition. And of course, you can look that up as well too, but it's out in a lot of our emails and publications. If the patient meets the definition of severe glaucoma, then you have to refer that patient, which is good management of patient care. Anyway, if a patient's got severe glaucoma, you really want to be presenting surgical options to them, and they probably need surgical management because they've already reached a severe stage of disease. So that's proper. And since we can't, unfortunately, do the surgery that that patient may need, which could be SLT or some other type of glaucoma intervention, we have to send those patients on to the ophthalmologist that can do those things. And, SLT is fast becoming more, first line care or care that is presented more often now. So it's a bummer we can't do that specific procedure, but in many cases, these severe patients are getting, combined cataract procedures with MIGs and, other type of solutions to try to lower their IOP that, isn't really in the realm of optometry anyway, doing MIGs and things like that. So referring those severe glaucoma patients is probably just good patient care. And that's ultimately why the law became the way that it did, because it made sense. So
Tommy, let's just ask a quick question on the first part. You talked about the opioid Well, I know there's some deadlines coming up, and I know this is probably short notice for somebody listening in on this, but can you speak to those on what we need in order to go forward, or if we need anything?
Yeah, let me pull that up as well too, because we just got a notification from TOA. So there's a required opioid course to maintain your license, and that was not a result of any of our scope bill stuff this time. That was actually a result of the previous session of an unrelated law that passed. Basically, every healthcare professional, no matter what type of doctor you are, has to take this opioid course. So it is part of like the general response of the legislature to the opioid crisis. And here it is 2 years later after the bill passed, and now the requirements are finally hitting where we have to do this to keep our license. There's a live webinar August 30th, which is Monday night. And Dr. Joe DeLoach is going to give that 1 hour of CE. It is free for TOA members, and it's $50 if you're not a TOA member. So I'll forward that on in case you want to forward that out to the group. And yeah, just an honor to be with you guys today. You know, I've been part of First Eye Care since I got out of school 16 years ago. First Eye Care is a great group. It's been a great buying group, and everything in your business life and TOA and your personal life, it's all intertwined. You know, there's not one segment that doesn't affect the other segment somehow. So being a part of First Eye Care, you know, with the cohesiveness and the leadership of, good business minds that have been in private practice for a long time is a really good, situation to be a part of. And then with TOA, of course, we talked about how that's important. So developing those professional business friends, and also your professional, relationship with your association by being a member and contributing to TOPAC, all of that's intertwined. So it's you kind of want to, as an optometrist, just take care of that base level of support for the profession, so that all of these things can keep moving and the wheels can keep turning.
Okay, thank you very much. And thank you if you are watching the video, and look forward to the next practice management video.